Okay,
All right, and you're good to go.
you got it. Terrific. So yes, so the name of today's presentation is When Caring Does Not Feel Like Enough. And we'll be talking about caregiver stress. And I added burnout because if we don't take care of caregiver stress, we go right into burnout. And I want us to be very aware of that risk. So let me hit this. Okay, let's go here. So as Allison has given you a little bit information about me, I am a health psychologist. I am working in California and New York through virtual visits. I do help manage emotional distress with patients with cancer and also other serious illness. And also I help their families manage the emotional distress that comes with the diagnosis of cancer as well as the treatment. I specialize in psycho-oncology and palliative care psychology. And as Allison mentioned, I'm licensed both in New York and California. And the modality that I use most often in helping my patients is the use of cognitive behavioral therapy, which I might talk about a little bit today. But probably the best and most qualification, the most important qualification for this evening is that I too have been a caregiver to several family members and friends. So I have been there. And so I am very excited to share not only from a professional perspective, but also a personal perspective on the caregiving experience. So before we talk about what we are going to expect in this presentation, I'm a little curious as to how many of you are caregivers and how many of you are patients or just interested parties. If you could, and Allison, if you can see how many are, if you could write in the chat how many of you are caregivers and how many of you are patients. It's helpful to know who I'm speaking to, who my audience is. And so that would be great if you don't mind doing that. So let me continue while you're doing that, and Allison will give us feedback as to who we all are, what to expect from our conversation, and I'm calling it a conversation today. One is to know the caregiver. Who is a caregiver? What is the caregiver experience about? Two is also to understand the patient and caregiver experience. You know, what changes? What are things to be aware of? And also to understand, as I mentioned, that caregiving is a very difficult task, and accompanied with it comes stress. And if we don't take care of that stress, we go into burnout. And so we'll talk about what does that mean? What is stress? What is burnout? And then the good news that we end on is there are ways to manage stress and burnout. And I will give you a couple of tips as to how to do that. And perhaps you can also add to the list because we're always learning, aren't we?
So Dr. Ray, majority of those joining us today are caregivers. However, there are many in the room who are both patient and caregiver.
Wonderful, wonderful. Thank you so much and welcome once again, everybody. So given that I'm speaking to an audience of caregivers, a lot of you might agree, and you're welcome to comment on the chat as I speak. Caregivers happen, right? As soon as your loved one, and I'm using loved one and patient interchangeably, as soon as your loved one gets that diagnosis of cancer, you know, whether it's curable, even if it is curable, you were never prepared, right? All of a sudden, we become the caregiver. It might be because of our own choice that we decide that we are the best suited. It might be that others expect us to be the caregiver. And sometimes we're it, there's no one else. So that's what I mean by caregivers happen, And what comes with that is that there's no preparation, right? There's no notice, there's no manuals. I don't know how much of you agree. Feel free to let me know in the chat. But caregivers happen and we are caught often unprepared, wondering, how do we do this? So I am looking at this Cancer Registry 2020 survey sponsored by the cancer support community. And they asked 688 caregivers a bunch of questions. And so all of this data is taken from there. And what showed is that usually the typical caregiver, and that doesn't mean if this doesn't fit that you're not part of that, but 80% of caregivers identify as female. And 53% are caregiving for a spouse or a partner. And about 25% are caregiving for a parent or a parent-in-law. And the average caregiving is about 3.6 years. As we all experience as caregivers, we wear many hats. Part of that is providing emotional support. Part of us that is going to medical visits with our loved one, being that extra pair of ears, because medical visits can be so detailed and intense. And some caregivers are involved with decision-making. In addition to that, caregivers serve as advocates. We try to focus on the quality of life of our patient in regard to pain, sleep, and nutrition. And we're the point person and the organizer. So we wear so many hats. It's not an easy task. I'm hoping you guys can see the slide because it's slightly blocked. Allison, can everybody see the slide?
Yes, we can see the slides. There's a chance that it might be blocked on your screen if there's something covering over it.
All right, no issue. I just want to make sure everyone can see.
Yeah, we can see everything really well. Thank you.
Cool. So caregivers have concerns when they find out that they're the chosen one. And sometimes you might be fortunate, you might have a partner who helps you, but self-doubt is the first thing that happens. You wonder, am I going to be able to handle this? There's so many things I have to look at. I've heard patients say, I am not familiar with the medical system, much less details about cancer treatment. Am I going to be able to handle this? And how, if I do take this on, what about my other responsibilities? What about my job? What about my family? How am I going to juggle? And also, am I going to do this on my own? So the first reaction when you realize that you have such a responsibility is the sense of not feeling sure, of questioning ourselves, of worrying. From the same survey, as you can see, you're not alone. 75% of caregivers felt that they needed more information about medical treatment and the side effects and what the treatment is doing. They also, more than 50%, needed information on how do you even navigate insurance and benefits. So all that you are experiencing is very valid and others are feeling the same. So in all of this, the caregiver is not alone in that now they're helping with the patient and the caregiver and patient relationship is formed. And there's so many changes, your life changes. Before you could travel, what's going to happen about that in between treatments? Before you might be able to go to a restaurant, although with COVID, We've all experienced the hesitancy on that end. But still, all the things that you would have enjoyed doing, you have to rethink. You've got to figure out, can we do it? Are we going to do it? So our life changes. Our roles change, right? I mean, you were in charge of dishwashing and your partner was in charge of throwing the garbage. Well, guess what? Sometimes now you are doing both. Or you're in charge of taking care of the house and your partner is responsible for bill paying. And now you're having to pay the bills. So there's a life change and a role change that comes with the diagnosis and treatment of cancer. And from the patient's perspective, it's how do I go through this? How do I fight this? How do I survive this? And how do I stay independent? And how do I stay with dignity? And the caregiver is hearing you. And it's something that both of you are battling together now. So that is something that the caregiver-patient relationship kind of shifts, and the roles shift, and the life context shifts. And there's always the question of why me, and also why not me? The caregiver deals with questions about why is this happening? Questions about why is it happening to us? And why did I not get this? There's a lot of emotional baggage, stress, burdens of guilt and shame and worry that comes from trying to understand what life has presented you. Also, what we don't really think about is the complicated relationships that may have been present with the patient even before the diagnosis. You know, maybe you guys had not seen each other in a very long time. Maybe there are issues of estrangement. Maybe for some reason your family has not really talked about serious issues. So it's very difficult to communicate. And this also, because of the complicated relationships, there might be triggers. There might be triggers where, now you want to speak about things and either one of you are not used to doing it because there are issues that have not been resolved. And this is something that I would recommend for you to access a therapist. Because for the caregiver-patient relationship to work, and a lot of you are in it now, you will agree communication between each other is essential, but it also can be very difficult. And so to be able to process what is not working, what did not work, and what needs to be resolved is very important. Also, it's very interesting, but there's a sense of loss. Nobody's gone anywhere. It's still, you guys, everyone's present, but there's a sense of that loss. And that's ambiguous loss, not really being able to pinpoint what is happening, but understanding in a way that our lives have changed. That's a loss. And then there's, of course, the fear of the future. All of this happens where not only is the caregiver being affected, but most definitely the patient is also feeling it. There are positive impacts to caregiving. As I mentioned, it's a great opportunity to build relationships. The sense of purpose that you develop in trying to be in charge of helping your loved one go through this journey is huge. For those of us who are taking care of parents, you think, well, they took care of me and now it's my turn. There's a sense of duty. And in all of it, there's an expression of love and caring. There are negative impacts. It's exhausting, right? Emotional exhaustion, fatigue, all that happens. And also it takes an emotional toll, depression, anxiety, and for the caregiver, often putting self-care last. because it's not my time, because I need to focus on the patient. I don't want to take any time out. I'll feel guilty. I'll feel ashamed. I'm not supposed to be doing that now. Those are things that I hear my patients say. And on top of all that, isolation. I'm the one to do it. No one else can help me. I'm the only one. I don't want to meet people. I don't want to see people. I'm too tired. Sounds maybe familiar among some of you. I hear it a lot. Once again, when we look back at the Cancer Registry 2020 data, you can see you're not alone. 58% of caregivers are unable to manage the patient's emotional distress. Less than half are prepared or feel prepared to handle the medical or emergent needs of their loved one. 68% are overwhelmed with caregiver distress. 39% identified that their own health was suffering, and greater than half felt a loss of control of their own life. So let's talk a little bit of warning signs of caregiver stress and check all that apply to you. Anxiety is one where you're worrying excessively. Fatigue, you cannot move, it's exhausting. Depression, we have a spectrum from sadness to really feeling sad most of the time for over a period of weeks. Caregivers report sleep and appetite issues. They find themselves growing irritable, and as I mentioned, they are isolating themselves. And they've lost interest in anything else that brought them pleasure. And so you would say, well, sure, I mean, this is not easy. Why would all this be, unusual? It's not, it's normal. But if it goes on for a long amount of time, then it's an issue. And that's why I'd like you to be aware of these caregiver signs of stress. Shh, I'm sorry, be quiet. So my dog is hearing this too. So basically, what happens if you don't care of the stress, if you don't take care? You get warning signs of caregiver burnout. Check all that apply. Exhaustion. If you push too hard without taking care of yourself, you're exhausted. Burnout results in cognitive dysfunction. You have trouble in thinking clearly. You're unable to make decisions. It's hard to focus. You're restless. Another sign of burnout is loss of empathy. You're numb. You don't feel anything. You're too tired. And there goes that isolation. You don't want to deal with anyone or anybody. And there's the irritability and anxiety. All these are elements of burnout. So without taking care of the stress that we talked about, this is what's going to happen. And it's really serious. So that's where my title of our presentation originated. When I thought about it, I said, caregiving is not enough if you don't take care of yourself. Because if you are unable to spend time for self-care, just think about it. Your whole system will react. Stress and cortisol are hand in hand. It impacts our immune system. You'll get more sick. You won't be able to be present. It impacts our digestive system, heartburn. It impacts our respiratory systems, our breathlessness, our cardiovascular system. Blood pressure goes up. We are a moving target if we do not take care of our health. Excuse me 1 minute, please. Sorry, guys. This is my emotional support.
It's very cute emotional support.
Sorry about that. Yeah, she's my therapy dog. She sits here all the sessions. But let me just say, going back, neglecting yourself, you're neglecting the patient. You saw the burnout. You saw not being able to be present. You saw the irritability, the loss of empathy. You're no longer a caregiver. So that's why I spend a little time on this. Neglecting your health will impact yourself and your caregiving. And there's studies out there where the patient picks up on the distress of the caregiver. So all in all, it's not a great thing. But okay, the good news, there are ways to get this done. There's ways to manage your stress. And I'm going to give you these tips. Number one, it's okay to not feel okay. Self-acceptance is a big deal. None of us are perfect, and it's okay to feel emotions. But along with self-acceptance, I encourage you to have self-awareness. And what that means is in the morning when you wake up, you just kind of take a breath and go, how am I doing today? And rate your emotional distress. 0, hey, I'm chill, I'm fine. 10, I am feeling really overwhelmed. When you're at 10, that's when you need to seek help. You need to find somebody, or you need to find a mental health professional to help you. Because if that's a 10 for over a week, yes. If it's a 10 today, take a walk, do something, talk to some relative or friend. But if it's many weeks, seek some help. If it's in the middle, 5, no problem. Find things that bring you joy. But that awareness, the self-acceptance and awareness are really helpful because it kind of gives you a sense of what can I handle and what do I need to be more aware of. This is something that I use as a cognitive behavioral therapist, and it's simplified, but it works. And so I'm sharing it with you today. Putting words to your emotions is big. A lot of people don't know. When you say, how are you feeling? They're like, oh, feeling a little warm, a little cold. Yeah, I don't know. Practice putting words to your emotions. Are you angry? Do you feel frustration? Are you anxious? Important, because sometimes you get triggered. There are things out there that trigger you. And you're doing, I don't know why I feel so bad. But that's where the thoughts come in. Why are you feeling this way? What happened? What's behind your anger? What's behind the anxiety? And in cognitive behavioral work, we do reframing. And let me show you what I mean. For example, we identify the emotion anger. The thought behind it is, there is no way this is going to work. Well, that might be true, but if you can reframe and go, well, you know what, maybe I can try to make it work one more time. Let me give it a shot. So the anger is created by the fact that you don't think it can work. But if you look at that thought and reframe and you say, well, maybe I will give it one more try, the anger will go down. Same thing, let's say with frustration, where the emotion is frustration, the thought is, this is not going to get any easier for me. Sure, it might not. Let's reframe. What can you do? I'll give it another try. Okay. For a moment, the frustration goes down. Same thing, emotion, anxiety. I've never done this before, is the thought. I'm not familiar with any of this jargon. I've never done this before. True. Reframe. But maybe it's an opportunity to learn something. Maybe I'll learn something. So this kind of dance between the emotion, the thought behind it, looking at the thought, and reframing is how I do my work with my patients. And the beauty of this, it takes practice, no worries, is it becomes something you can do on your own. And it's something that will help you regulate your emotions. And then bottom line is there are just some things you cannot control. Let go, let go. There's just some things that you will not be able to change. Do the best you can. And after that, just let it go. It takes a toll upon you. Tip 3, positive affirmations. You know, I bet all of you will agree. Our inner critic will give you a list of everything that's wrong about you. But if I ask you, give me 3 things that you like about you, it's hard. It's a task. A lot of people find it very hard. Well, that's where self-doubt can be conquered. I encourage you every morning, get up, look in that mirror, and give 3 things, state 3 things good about you. Examples. I am making a difference. I am a caring person. I am able to learn new things on how to care for someone. That done on a daily basis will remind you of what you can do. It will help you get rid of that nagging self-doubt. Be there for yourself. That's tip 3. Tip 4, breathe, breathe. Just breathe. And we're going to take a minute and try this. So let's just do this together. Take a breath through your nose, and we're going to hold it for 4 counts. I'll do it with you. Let's breathe in. Hold. 1, 2, 3, 4. And breathe out. Count for 6. 1, 2, 3, 4, 5, 6. Let's breathe in the positive energy. 1, 2, 3, 4. And breathe out negative tension. Hold it for 6, 3, 4, 5, 6. You just did a most amazing thing for yourself. This is self-care. How long did it take? A couple of seconds. Do it. Do it 3 times at one a day, in the morning, in the afternoon, when you just can't take things. Take a moment, breathe. There are scientific studies out there on the benefits of oxygen. We are oxygenating our system. When we become tense and upset, our muscles get tight. We don't breathe deeply enough. Breathe. That is one of my most favorite ones. Also, tip 5, do something creative. You know, go and listen to the birds and paint or whatever it is, you know, just go enjoy a little bit. Get some help. Have someone come in for a little bit of time. Set yourself free. You need to rest and rebuild to be there for the patient. Do them a favor, do yourself a favor. Find some joy. And tip number 6, reach out to others, the cancer support community, the family. Engage with others, end your isolation. It takes a village. I have a friend who is going through cancer, and she and her partner, they opened up this wonderful communication in the cancer support community. I believe it's called Gilda's Club. And in that, they both were able to write down what they're going through. And that was so amazing, not only for them, but also for all of us who were out there wandering, wanting to help, really loving them and not being able to know what we can do. It takes a village. It helps in so many ways. So do reach out as much as you can. That's tip 6. And finally, seek mental health professionals, seek therapy, seek support. There are wonderful ways that we can help as mental health therapists to make this journey easier. You don't have to do this alone. The community is there, the cancer support care community is there, and there are many of us out in the community in private practice. We are here for you, but your mental health is important. And as a caregiver, I can tell you, knowing that I'm not doing this by myself and knowing that I'm taking care of myself is really important, not only for you, but for your loved one. So I have one more. So if you'd like to hear more, if there are questions that you'd like to send me, directly, feel free to do so. This is my contact information. There's also, Allison, I believe you've attached a link at the chat that you can, give me your email, write down your question, and I'll be sure to answer. So right now I'd like to, we have about 20 minutes, and I'd like to open it up for some conversation. And I'm going to take myself off share. Okay. Thanks so much, everyone, for listening to me.
Thank you so much, Dr. Ray. I'm going to go ahead and stop recording. Just want to give you a little round of applause. If we were in the room together, you would hear that come through. So I'm going to stop the recording.